Hi, this is Mark Shulman at the Physical Therapy Effect in San Diego. I do a lot of the treatment for our TMJ dysfunction patients, and one of the questions that I often get asked is whether or not a night guard is a good idea. And oftentimes I say, if you're having any tooth wear or fracturing of the teeth or cracking of the teeth, or you're having any specific tooth pain, a night guard may be recommended. And I would say talk with your dentist and get a custom one made rather than the over-the-counter. The over-the-counters oftentimes are not necessarily lined up to your bite. You will get strange wear patterns in there. And what that'll do is that'll actually probably exacerbate some of the problems you have going on, because what you'll do is you'll bite down on the side that's closest to the prosthesis, and the other side will kind of not really touch and nothing will change. So again, if you're going to do it, make sure that you do talk to your dentist, and that way you get the custom bite guard that you need. Now, oftentimes I actually don't recommend it just for simply grinding your teeth at night or clenching. And the reason I say that is that there's other ways to maybe get around this that don't affect the bite, that may not cause as much pain in the jaw. So one of the simple ways that I teach people to do this is I just have them bring their tongue up onto the roof of their mouth as flat as they can, and focus on breathing through the nose. Once they're breathing through the nose, there's a lower likelihood of clenching. So as the tongue is pressed up against the roof of the mouth, it actually makes it kind of hard to actually clench down very hard. So if you can practice this, a great time to practice this is throughout the day, but specifically within 5 to 10 minutes prior to falling asleep. And then what you can do is that'll help relax the brain a little bit. That'll calm you down, oftentimes breathing through the nose. And so then you should feel a little bit better going to sleep. If you do happen to wake up with a little bit of tightness in the jaw again, go ahead and put that tongue back up on the roof of your mouth and just try to breathe through the nose and see if you can fall back asleep. Sometimes this is very difficult for people because maybe there's a deviated septum or there's some sinus issues going on there, and that's something that you may need to speak to your doctor about regarding your maybe an ENT potentially, regarding the potential for deviation and things like that. But the tongue on the roof of the mouth should help with reducing the overall grinding at night. So if you are looking to also throughout the day try this, you can do it anytime that there's a kind of a break in your day, or anytime you finish 10 emails or 10 pages of reading, something that just cues you into finding that time to put the tongue on the roof of the mouth, breathe through the nose, and try to calm down. You'll oftentimes feel that jaw relax. So if you do have any other questions, feel free to comment, send us an email, reach out to us. We're always here to help you, and you can reach us at the Physical Therapy Effect in San Diego.